One of the most important goals in cancer medicine is to select the best possible therapy for each and every patient. So let's start our conversation in this session by looking at the biomarker data from the relativity study. I do want to preface that these data are exploratory. That said, the data from relativity suggests that patients may benefit with combination anti-PD-1 LAG-3 versus monotherapy anti-PD-1 regardless of BRAF mutant status, LAG-3 expression, and overall disease burden. The one biomarker where the signal was less supportive of the benefit of combination therapy was PD-L1 expression. Patients with PD-L1 staining of greater than 1% did not clearly benefit from combination therapy as compared to monotherapy anti-PD-1. Omid, I know you presented the data recently of fianlimab plus cemiplimab. You want to talk a little bit about the biomarker data from that trial?
Thanks, David. This combination, we presented biomarker data in about 40 patients. What we also saw were high response rates in patients, including the LAG-3 expressors less than 1%, that had about a 40% response rate. Interestingly, LAG expression that was high, greater than 1%, or PDL expression that was high, had response rates in the 70%. And that's a significant response rate for a combination that has minimal toxicity.
Omid, how have you been incorporating these exploratory data regarding potential biomarkers into your practice?
The idea that we have these biomarkers indicates that we need to work harder to integrate them prospectively in order to limit toxicity for patients who do not need more therapy. So single agent therapy may be all that these patients need, specifically for the patients with PD-L1 greater than 1%.
Thank you, Omi, for that insight. Now, as we've seen today, combination of anti-PD-1 and LAG-3 has an important improvement in efficacy and a reasonable safety profile. Selecting the appropriate therapeutic regimen for each and every patient remains a significant priority. Finding biomarker data that can help us choose the appropriate therapy for the appropriate patient is paramount. And with that, we will conclude. Thank you for your attention. We hope you've enjoyed this program.